Hi, Paul.
Hi, how are you both?
Great, how are you?
Real good. Everything is beautiful. Wait a second. State University of New York at Brooklyn. Okay, we're in Brooklyn.
Right dead center.
Right there.
Accent on the dead.
All right,
Where are you, Paul?
We're in Brooklyn.
You're in Brooklyn?
Right on Flatbush Avenue and next to BAM, Brooklyn Academy of Music.
You're right here.
We just moved out here from that New York joint.
Okay, good. Wow.
So it's real cool here. And you should come over. We got a green television studio, a whole built on green spaces. Everybody's sustainable in this whole building here. Wow. 33 Flatbush Avenue.
Great to know.
So let me just get some administrative information. Actually, this way we can also invite you to parties and things. If you have an email address, and we can send you a thank you for this interview, if that would be okay, just for our own internal use. So, Charla, do you have an email?
Yes.
Okay.
Charla Krupp at gmail.com. Oh, I'm sorry, ckrupp at gmail.com.
At Gmail, okay.
And I'm H. Baldwin at downstate.edu.
Baldwin at downstate.edu.
Yes.
Oh, I know. Okay. My brother-in-law went there. Okay. So, work there. And let's see here. What else? What website? Oh, what website should we link over to for this interview?
bestfaceforward.com.
bestfaceforward.com.
Yes.
Okay, we're getting all the administrative stuff. Give me 1 second. Let me just try to also pull the website up. www.bestfaceforward.com. Okay. Let's see if that comes up, and then we'll talk.
Great.
Come on. So where are you, in the city, Manhattan?
Yes, we are.
Okay. You live in New York area?
We're in Soho. I live on the Upper West Side.
Yay! That's where I live.
Brooklyn.
And you live in Brooklyn?
Absolutely.
You literally live here. Oh, that's good.
Paul, where do you live on the Upper
West 80th Street.
West 80th? I'm at West 84. We're neighbors.
All right. Were you in the park this morning?
Yeah, I thought I saw you were pretty nice.
All right, this is all good. So, and it's a beautiful site. And what am I doing next now? Okay. Hi, this is Paul Slack's Good News Broadcast. I'm speaking to Charla Krupp. Hi, Charla. How are you?
Hi, Paul. How are you?
Okay. We're neighbors on the Upper West Side.
Love that.
There we go. National fashion and beauty expert, New York Times best-selling author, How Not to Look Old. All right, good news there, right?
Yeah.
And we have Hilary Baldwin, Dr. Hilary Baldwin, MD, leading dermatologist, former president of the American Acne and Rosacea Society. Do I say that properly?
Rosacea.
Rosacea. What is rosacea?
Rosacea is a chronic inflammatory disease of the center of the face, which is most common in women between the ages of 30 and 50.
Uh-huh.
It happens in about 14 million Americans, so it's incredibly common. And it gives you a redness, a flushing, and a blushing of the face. And also you can get pimples, big red tender pimples, and pus-filled pimples in the center of the face as well. It's eminently treatable, and that's why we're here to talk to you about it today.
Okay, and let's start. What causes it?
Well, I wish I knew the answer to that question. Right off the bat, you stumped me. We're not exactly sure what the cause of rosacea is, but we're quite confident that it has to do with an inflammatory process that gets worse as you age, perhaps related to sun exposure, maybe just your genetic destiny that you're fulfilling. But clearly there's inflammation, and as such, there's lots of medications that we can use that are anti-inflammatory in nature. For example, a pill called Oracea, which is not an antibiotic and is safe, therefore, for long-term use, just once a day. We have lots of topical gels that can control it, as well as laser and light therapy. So if you think you might have this, you want to make sure that you go to see your dermatologist and get on these really great medications, because nobody needs to suffer with this anymore in 2009.
So it's not that you're blushing or you're embarrassed and you're turning red. I'm just kidding.
You know, that may be a little bit of it as well, but if you're blushing when you're not embarrassed, then you really need to see your
Of course. No, this is a serious concern.
You know what, Paul,
has this been around for years?
Yes. It's coming up a lot because women
30 to 50 are getting it, and of course that's, members of the baby boom population and my target audience for my book, How Not to Look Old. But it's one of the problems that women have as they age, and the best solution is to go to a dermatologist. A lot of women these days are very independent. We go on the internet all the time. We think we know everything, but this is one thing that you really do need to go to a doctor, because there's a lot of different types of rosacea. And if you go to a doctor and you get a prescription, you can take care of it and manage it. And this website, bestfaceforward.com, lists all the possible triggers for your rosacea. There could be a lot of lifestyle issues, things that you're doing that you don't even realize that is really triggering rosacea, like maybe wine or, a glass of any kind of alcohol could be something, the next 5 minutes you could get a big flare-up. So there's other things that are in the environment, like extreme hot and extreme cold, you really want to stay away from. That could be a trigger. Also, the kind of foods you eat. Really spicy foods, a lot of chocolates, that could also be a trigger. So if you go to this website, bestfaceforward.com, and you look at the triggers, and you keep a little diary, you will know, what is specific to you and what you can do about it. And my book is all about women taking charge of their lives. And if you take charge of your skin, you will really feel so much better, because when you meet new people, they're looking at your face, and if you feel bad about your skin, if you're having a bad skin day, it's much worse than a bad hair day.
Well, doctor, aren't there, I'm hearing lots of different potential causes of this, right? But, isn't there, haven't been there some large studies that, everybody had wine and they're the ones that got it? Or, what have we learned over some time? Because it's now 14 million Americans. That's a pretty significant concern, right?
Well, what we've learned is that everybody's different, unfortunately. I can't give you a recipe for disaster here. Some people have certain items that make them worse. Some people have no triggers. It just happens when it feels like it. But there are people for whom a couple of sips of wine is a guaranteed lead-in to a flush or a blush reaction or to getting more pimples. So the point is that if you know what your triggers are, you can learn how to avoid them in times when you really don't want to have it. And you can also learn what medications to use to make you better.
So is it, maybe you said this, but maybe I missed it, is it an allergic reaction? Do they call this an allergic reaction, say, to wine?
No, it's not an allergic reaction. It's something that wine, for one reason or another, just triggers you to turn red, and we're not really sure exactly why that is. That's why it's so important to actually seek help in this regard. Are you allergic to wine? Do you actually have a problem with the sulfites that are found in wine, and that's why you're turning red? Or do you have a disease process that can be mitigated with a medication? And then maybe you can have a couple of sips of red wine every now and then, and you don't have to avoid it altogether. Life is short.
Yes.
If spicy foods and coffee and wine are what turn you on, to avoid it for the rest of your life is really a shame.
And what do some of these medications do? How do they help?
Well, the medications help by being anti-inflammatory in nature. As I mentioned, even though these pimples look like acne pimples, they're not. They're purely inflammatory in nature. There's no organism in there that's causing it. There's no bug. So you don't need full antibiotic doses. And what these medications give you is anti-inflammatory nature without the antibiotic taking a ride along with it. And we know now that we're all concerned about bacterial resistance and MRSA or MRSA infections, so it's very important for us to use as little antibiotics as possible. And these gels and the eraser that I mentioned before have the ability to do that for us. So, what we're aiming for here is to sort of discipline your skin, get it used to not having the zits on it, not flaring up with these flushes and blushes, so that we can give these busy women, as Charla was talking about, the opportunity to know what their face is going to look like when they wake up in the morning. It's not going to be a surprise. You're not going to wake up one day and look fine, and then that very day that you need to look your best, wake up with 6 or 8 or 10 pimples in the center of your face.
Okay, you can get instant savings on Best Face Forward on the website. Let me ask one last question. Charla, what is good news for you?
There's good news is that you can look really good even if you have rosacea, and if you just use the right makeup. For example, like a liquidy, dewy foundation will really make your skin so much better than something that is with minerals or powder-based. And a creamy blush will look so much better than a powder blush. We've gotten to the point where there are so many good products out right now that you can really control this and you can look your best every single day. There's no reason to go around with a big red mark on your face. I mean, this is really disturbing for women. I hope you understand that this is a problem.
I agree with you.
And so many women right now, not only women, but a lot of people are out of work. They're looking for a job. They need to look as good as they can every possible day. And if you have a flare-up and pimples, you're not going to look as good as you can. So this is an opportunity to really take care of your skin. If your skin is good, you could look really beautiful. If your skin is bad, it's going to affect your whole overall appearance and psyche. So take care of it.
Doctor, one quick one for you. Does this affect men?
Yes, it's more common in women, but it certainly affects men. In fact, it may turn out that it actually is fairly common in men, and we just don't know it because men don't go to the doctor as frequently. I certainly, in my practice, see a lot of men with rosacea.
Okay, and last question for you is what's good news for you, Dr. Baldwin?
Good news for me is that there are medications out there that are incredibly effective, so go see your dermatologist and get on one of these medications, and then go to this website. It's got a lot of information for you. If you think you may have the condition, it will help you to know whether or not you need to seek care and how to do all these nice beauty tips as well to control you while you're waiting for the medications to sink in.
Okay, congratulations to both of you. Thank you for sharing very important and good news.
Thanks, Bob.
Take care. We'll see you in the neighborhoods.
Thanks.
Both
definitely.
of you. Okay. Bye-bye.